here. You want to start that? We're going live on Instagram, YouTube. Hopefully the audio is good. Cool. Tell your followers. Okay. Cool. So for everybody who's watching this later, we're just waiting for a few people to get on. And then we'll get into this. We're gonna do a Q&A here. We're gonna show you guys our new Warren location where we're working with athletes. And then we'll talk about some other things going on here at the OAI. Your questions.
Should I flip the camera? I'm walking around with it.
Yeah, when we walk around, we will. All right, so we got a couple people popping on here on different platforms. So we got Facebook, Instagram, YouTube. Let's tilt this so they can see. I got Dom here too with us from the OAI if he wants to pop in. What we're going to do is we'll answer your guys' questions, so definitely drop them into the comment section on here. We're going to show you guys the facility here in a second. I'm going to go through some questions, answers of people that have asked us stuff recently. And if I'm not looking at your camera, it's because we got 3 of them here. So I recently had a question regarding weighted baseballs, throwing weighted balls, and talking about, like, should I do it, should I not do it, and how could I do it if I wanted to do it? And basically, you know, it's kind of a complex answer. We've talked about it in the past, but basically we're looking at weighted balls as something that we need to differentiate between a few different things. Number one, we need to look at a weighted ball. Is it an underload? Is it an overload ball? Because weighted usually has the implication of it's a heavy ball, but we see these weighted ball programs, and generally it's unweighted balls or lower weighted balls with the heavy weighted balls. So if we have something like that, we're going to think, okay, we need to differentiate heavy balls from lighter balls, and then we need to talk about really heavy balls and then really light balls. And generally, when we're talking about this sort of thing, the heavier balls have been shown time and time again to increase stress in the arm. It doesn't mean I'm saying not to use them. It doesn't mean you shouldn't use them. But they're definitely going to increase the stress, the external load on the elbow and on the shoulder. So you're increasing your risk of injury, especially if you're throwing those for a long period of time. Now, here's the other component. When we're using weighted balls, you make sure that's plugged in. It's plugged in. You can come out here, dude, if you don't want to be back there. We're talking about weighted balls, and we're talking about increasing the stress on the arm. You know, we're talking about a few things, but basically, it's not just the peak valgus load that's on the elbow. So when you go and boom, there's a peak load on the elbow when the arm snaps back. It's not just about that peak load. It's also about how long that load is applied. So we know from solid mechanics and tissue biomechanics that the longer a load is applied, the more strain or the more deformation of the tissue. So if the tissue deforms to a greater extent, what we're going to see is that there's more chance of injury because the load is being applied. So it doesn't have to be a peak load that's really high. It can also be a somewhat lower load that's applied over a prolonged period of time. High stresses and a peak load with a heavy ball, yeah, they're not great, but also if we think about the time through which valgus is applied or time through which apprehension is applied in the throw, the heavier the ball, the longer the acceleration phase, the longer stress is applied. So those are just some things to think about. Hey guys, whoever's on here, drop some questions in the Q&A and we'll get to your guys' questions. And then in regards to, you know, whether you should throw them or not, it's never something we advocate for our younger throwers, for our guys who, you know, are coming off of an injury. We don't advocate it. Our skeletally immature throwers, it's not something we often advocate. But, you know, you're skeletally mature, you're at a position where, hey, it's a do or die type thing in my career, it's probably a good tool to try because you're kind of at that last ditch effort type thing. But what we see a lot of times is that guys have not actually done everything they can in order to get their body ready and their arm ready to pitch or throw at a high level. And they look at this as their last opportunity, like they've tried everything, when in fact, most of the time, if not all of the time, there's many other things that would be things that we would utilize prior to ever initiating a program like that, because they're going to have a more drastic effect on the athlete long term. I think I saw maybe Joey Lochner on here, I don't know. If you guys have any questions, drop them in the comments. I want to get to all your guys' questions. I'm going through some questions that people have actually asked us in the past. So drop them in the comments section. Instagram, YouTube, Facebook, one of the two, and I'll get to those. So whether you should initiate or not, I think that you're probably increasing your risk for injury. So if you want to do it, understand that you're probably putting your arm at a greater risk for injury, but at the same time, maybe 15 or 20% of people are going to see a great benefit. And the people who are out there thinking that everybody sees a big benefit from it, they don't. And that's why when we work with athletes in therapy, these aren't the people you hear about in the testimonials online. These are the people that got injured and got shunned from, posting their response online to some of these programs. So we see it every day. We just had an orthopedic surgeon in our office just the other day receiving some treatment for some things going on with him, and we were talking about weighted balls, and he was like, I hate weighted balls from the perspective of youth and their arm injuries. From a perspective of money on my part, I get a lot of athletes that are sent to me as a result of injuries that occur due to weighted balls and weighted ball programs. And that doesn't mean that it's always the weighted ball or always that program, but it's a lot of times that program for that specific individual. So I see some more people jumping on here on Instagram. Drop some comments, drop some questions. I want to get to you guys' questions here. We're going to show you guys, once I get a couple more people on the platforms, we're going to walk around. We'll show you guys a little bit of the facility. You guys can't see much here, but this is kind of our weight room area in our new De La Salle Warren location. So it's undergoing some renovations, so we'll show you guys that in a second. We're trying to get some more athletes coming over to this location. So in regards to other questions we've got, we just got a question regarding long toss as well. And we're hitting on a lot of these things that are kind of the in vogue type of things that people are doing for training. Long toss, we have a blog that Ed Martell, the founder, wrote on the site a long time ago. And when you're looking at long toss, you got to look at the angle at which an athlete's throwing, and are they dragging their arm through excessive stress and strain early in the throw? And a lot of times athletes are. If I see an athlete with a low elbow, long toss is not something I'm ever going to use with them. Why? Because if you want to throw on an upward trajectory, you're going to have to get your elbow low and go up. That's already their biomechanical fault. That's already what they're doing incorrectly. So then having them throw from that position on an upward slant is just facilitating what they're already doing incorrectly in their throw. If I have an athlete maybe that's too high and internally rotated, at times it can be an effective tool. But I have to understand that as I throw on an upward trajectory, as I drag my arm through valgus, and as I try to throw farther and farther on that upward trajectory against gravity, I'm increasing the load, the torque on the elbow. So we have studies to confirm that, just like we have studies to confirm that with the weighted balls. And just to go back to that, if we're talking about underloaded balls, there's a few studies that show they maybe increase peak valgus stress. I'm not sure that they do, based on the research that I've seen, and I'm not sure that that peak in valgus load is necessarily injurious, in that athletes who have that peak with a lower weighted ball, it's going to be as injury provoking as a heavy weight ball that I drag through stress for a longer period of time. See some new guys jumping on here on Instagram. Drop some comments and we'll get to your guys' questions. I see one here. How to fix a low elbow. So how to fix a low elbow. I don't know if I've done a YouTube video on this before. Barker Baseball, I see dropped the question. But low elbow is an interesting thing, because with the low elbow, we often see that the athletes push up through the acceleration phase and drag their arm at the end of the throw. So a lot of times it's insufficient lift. Sometimes it's one of two things. Either a lift into excessive internal rotation too high that drops down and causes a low elbow, or athletes externally rotate too early, take the ball like this, and then their elbow's low as they go forward. So some things that we'll do, we did do a video on YouTube, which you got to check out, the ladder drill. We use the pocket path with it as well. I don't always use the pocket path for the low elbow. I've found that I'm more successful using that for an elbow that gets too high. But the ladder drill, where I'm having athletes pull the ball in from different positions in different directions. So I'll start high. Don't let them pull too low, so they got to start their throw before they pull the ball in. And the reason for that is I'm trying to increase the time pressure. So if they're here and they have as much time as they want, they can pull it back to that low elbow position. If I have them hold the ball up at the top and then pull in at the last second, they can't possibly get their elbow too low. So often I start with just pre-positioning the arm in a better position. Then I have them start where they're starting high as they go, and then eventually they're pulling up, 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 and I'm working them down a ladder. So think of rungs on a ladder, and then we're hitting different spots. So they're going to pull up from here, they're going to pull in from here, 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 and make a throw every single time. And that's an effective technique, but there's a lot of things we do to fix a low elbow. I would say in general, pre-position them in the ER apex, or we just talked about the IR apex, because Dom, who you guys saw a second ago, actually sent us over a video of Corbin Burns doing the IR apex throw with a connection ball here. So I'll position him in this IR apex, and now my elbow's as high as maybe my Adam's apple, maybe my chin. It's at least as high as my shoulder. The ball's in close, and I've turned the ball away. So now I'm in this position, initiating the throw from there. They have to keep their elbow up as they go forward. Does that make sense, Barker? I see some other people logging on here. Definitely drop some questions, because we haven't gotten any questions over here on Facebook yet, but I've seen some people on there. So happy to answer whatever you guys have. In regards to what we got going on here at the OAI, like I said, we just kind of opened up our Warren location here for Health Quest. We're working with a lot of athletes out of this location. But additionally, I just recorded some stuff. Really good YouTube videos are coming at you guys. And then also, for my YouTube fam here, we're going to be putting out podcasts. I just did one with Peter Caliendo from Baseball Outside the Box, Team USA coach, phenomenal guy, great coach, and somebody who really understands how to orchestrate practices and how to get the most out of training for athletes. So I got that podcast coming out. I did one with Darren Smith for everybody who's interested in continuing education. Darren Smith's a PhD. He's an athletic trainer at Concordia, Wisconsin. He's a professor as well. I believe he works in the athletic training department there, and then he's also a professor at Rocky Mountain University. So he's going to have some great information for everybody who's thinking about, pursuing a further education, further degree. We're going to post that podcast soon as well, and I got some other stuff coming at you guys. We're still in preparation. We're still working on content creation for our certification programs. So those are something that, we're continually putting effort in. We're going to take some videos for that today. Barker Baseball, yes sir, love the ladder drill idea. I've been struggling with a kid doing multiple drills trying to fix his low elbow. So without knowing exactly what you've applied, and it's funny because it almost seems like I'm just talking about weighted balls and some negative implications. A weighted ball, maybe a pound weighted ball, thrown at 50%. Have the athlete just start in a pre-position. Have them throw with a weighted ball. Get them that kinesthetic feel that they have to push up against gravity. We'd call this error augmentation, which I did a video on recently. It's tough to do with the arm. But basically, we talk about different ways, and Dom and I have actually been talking recently about different ways you can alter athletes' throwing mechanics. And one of the ways in which we can do it, and we've kind of laid out 7 different ways in which, and maybe it could be broken down to a bit further, but 7 ways you could alter somebody's throwing mechanics. And one of those ways is to actually facilitate the athlete in the direction of fall. Vance, dude, I'm up here at Warren. I know you're a patient up here. How's the arm feeling? Let me know in the comments. But we facilitate the direction of fault. What that does is that makes the athlete initiate in the opposite direction or contract harder or work harder in the opposite direction. So 1-pound ball, start them in a pre-position, then have them go, use the ladder drill, use a connection ball in the IR apex. So we just talked about the IR apex, and I would say that 98% of the time, if you're doing it right, you can fix an athlete's low elbow or at least improve the athlete's low elbow with that eye or apex position, as long as you got them in the right position. Rotate it away from the target, internally rotate through the hip, ball's in close. Ball is about hairline height for these guys, elbow just above the shoulder. They have to maintain that height as they go. You could actually put a connection ball in this position. That's another way to improve a low elbow. For you guys that just logged on YouTube here, we're talking about improving a low elbow. What else? Have them, this is initiate in the opposite direction of the fall. Another tool that we have working with athletes, have them start with a very low elbow. So low, in fact, that it feels peculiar to them to have their elbow that low, and then have them come up against gravity. So they have to push up and then throw. I would not suggest a 1-pound ball for athletes younger than 10, 12. In fact, I don't, even with my high school, college guys, if I was to use a 1-pound ball, I would use it for like maybe 4 or 5 throws. Maximum of 8 throws. For a 10 to 12-year-old, try like a 7 or 8 ounce ball. 5, if they don't have any elbow pathology, no elbow injury, you could do 5 to 10 throws and have them keep the elbow up as they go. All right, let's, we're gonna show you guys the facility. Keep throwing your questions in. Vance, dude, you never said how you're doing. Throw your questions down below. Vance, let me know how you're doing, dude. And we're gonna show you guys the facility, so keep the questions coming. Dom's gonna grab this one. I got 2 here. All right, so here's the, I got the forward-facing camera. Here's the weight room. So this is our weight room at our Warren location. She got a baseball player over there right now. Kind of a slow time for us with tryouts and everything like that, but still some good stuff. We got some new equipment over there. We got a pretty cool total gym. We'll take you guys out here. More equipment coming in. There, more equipment coming in here. We'll take you guys into the clinic really quick here. So this is our treatment area. Say hi, guys.
Hi!
So this is kind of our treatment area over here. Few treatment tables, all our stuff that we're going to use in here for manual therapy, some exercise stuff when we're not in the weight room. We'll take you guys out here. We actually have a treatment room down that hallway there. We have a nice individual treatment room. Now let's take a walk in here. So here's the actual gymnasium. Some basketball stuff going on. You can see there's actually a mound set up over there in the corner. Uh-oh, poor connection. Got a poor connection on this here. Reconnecting. We're reconnecting on here. Release. I will get to your question. Oh, question's gone. Put that question back in there on YouTube. But here's our gym, nice track going up and around. Batting cages up top. So you guys can see that. So we're gonna take you guys back in here because we're getting, I think it was Mohammed said something about reducing load on the shoulder on YouTube. Put that back in there for me and I'll answer that for you.
Good.
All right, cool. So this is kind of, and we go right from the weight room into the there. So just kind of nice setup here. Still renovating the weight room. Oh, there's Carter. We're on live stream, dude.
What up, what up?
Carter's handling a lot of our stuff out here at the Warren location. Like I said, whoever's dropped questions on YouTube, they disappear so dang fast. I don't see them all. So put them in there again and I'll get to them. All right. So hope the audio is good for everybody. Dom, if you want to plug that thing in so it doesn't die on us. We're probably going to be on here for another 15 minutes. Here it is. Sir, how can we reduce load shoulder with my labrum tear? So how can we reduce the load on the shoulder? Are we talking about throwing? Are we talking about just in everyday life? What are we talking about here? I just saw that one. Drop your questions, guys. and I'll get to them. How many people have questions today? A lot of people send me some questions, so I can answer some of those too. With a throw, baseball, cricket, what are you playing, Mohammed? Also just had some questions from a quarterback, so while we're waiting for him to respond. So quarterback throwing, you know, and I actually just had an athlete baseball player, infielder. I'm using throwing a football, which is kind of cliche a lot of times now, but we're using a football to actually improve his warm-up for throwing a baseball, because when he throws a football, he approximates cricket. Okay, I'll get to that question in just 1 second. He approximates better, he gets his arm in better, and he gets his elbow a little bit more out in front of him, and he tends to drag and drop his elbow a little bit. That's been his traditional motion when he throws from the infield. So we talked about a low elbow, and he was one that really, really had a low elbow. I mean, we talked about the iliac crest right here. I mean, he's at the top of his iliac crest when he's coming forward, throwing from the infield, and it was severely impacting his velocity. Really, I mean, he's hit 87 on a crow hop right now, and he was like 70-something, 77 on a crow hop before. So the low elbow can really drastically decrease your velocity, but it also can implicate, you have implications for elbow injury and also shoulder injury, a lot of internal impingement and stuff like that. So what can you do to reduce the load on your shoulder and throw? I've worked with some cricket players. I don't generally work on the bowling aspect, which for everyone who's not familiar with cricket is the pitching, because it's definitely peculiar and I don't have a ton of experience with that. That's not my expertise. But throwing from the field in cricket is the same way as softball and baseball, overhead throwing. And the most important thing you need to do, Mohammed, is you need to work on getting your arm in the right position at the right time. Really, I just worked with a pretty experienced cricket baller from somewhere, I believe in the UK, remotely. So that's an option. You can send me a message, email overheadathletics.com or overheadathletics@gmail.com. But you need to improve the throwing mechanics. That's going to be the most important thing. Improving your rotator cuff strength is not going to hurt either. It's definitely not going to hurt to improve your rotator cuff strength and improve how you move overall as an athlete. But the most important thing is going to be improving how you throw. So without seeing how you throw, it's hard to say. But mechanics probably have a bigger. I want to say mechanics probably have a bigger influence on torque at the shoulder than they do at the elbow. So, another person from the UK, Jade. Very cool. Very cool. I've only worked with one person from there. I don't know how much baseball they play. I know they do play some, but cricket's a little bigger, I'm guessing, there than it is in the US, although it seems to be growing here. I follow some different cricket pages online on Facebook. So, I just saw another question on YouTube here, something about tingling, numbness down into the hand. I don't know exactly what's going on. It sounds like you have something medical going on. There's a lot of things that be causing that. Have you been seen by a physician, either like a neurological physician, neurosurgeon, orthopedic surgeon, vascular surgeon, anything like that? Sometimes symptoms down in the hand, especially color changes, are indicative of pathology of something systemic, or you could have, looks like we just lost Facebook. That's all right. I don't know why it died. It's plugged in. It's all right. South Africa. Okay, I'm not great with my geography. I don't know your flag, but that's sweet, Jade. South Africa. So you guys play a lot of cricket there, or what are you guys doing there, Jade? And then, I don't know where we're talking about, but in regards to changes in the hand, changes in symptom, fingers, that sort of thing, you need to get checked out by a physician. I get a ton of stuff on YouTube, so if anybody's watching this on YouTube, if you're commenting to me on YouTube and you're asking me about how do I fix my shoulder, how do I fix my elbow, and you're 3,000 miles away, I don't know. I don't know what's going on with you, especially if you're giving me symptoms that seem more medical. And most of the time, my advice to people is you need to see an orthopedic surgeon, you need to see a sports physical therapist, or you need to see an orthopedic physical therapist. because we need to figure out what's going on. And if your surgeon has told you that this is as much motion as you're going to get based on your anatomy after an elbow fracture or after some sort of fracture, or that's just based on your morphology, then I mean that's probably what you have. You could get another opinion, but as a physical therapist, I'm not ordering imaging and that sort of thing. You need to get a plain film radiograph. You need to get a CT scan, MRI. Austin, go to exercises for distal biceps tendinopathy in picture. So talking about exercises for distal biceps tendinopathy for pitchers, I actually just saw an athlete with this somewhat recently, and it can be tricky. Dealing with bicipital tendonitis, in the shoulder is a little different because a lot of times, as you know, Austin, I believe you're a PT, correct me if I'm incorrect. A lot of times you're dealing with so many other things, and that's happened as a result of something else. Matthew, I think I just got an email from you that I have to respond to. But distal tendinopathy is a bit different, and if we can differentially diagnose it and say, hey, it is actually the biceps tendon, I think a lot of times what we need to do is start to, number one, load the tendon with isometrics, which isn't always done, and then we got to be careful with tendinopathy, I think, with eccentrics even, but eccentrics, have been shown in the research to do a lot for tendinopathy. And a lot of time, I think with the distal biceps tendinopathy, it's kind of indicative for a pitcher that they're using their biceps way too much in the throw. We know that you shouldn't be using your biceps all that much. I want to say, based on EMGs, and I have them all saved, so I'll have to go back and look, but I want to say the biceps should be contracting at approximately 40 to 50% of its maximum voluntary isometric contraction during the acceleration and deceleration phases, maybe as high as 70. We see in our youth pitchers, we see in our guys that drag their arm or have a shortened deceleration arc, we see that spike above like 120, 110% of their MVIC, maximum voluntary isometric contraction. Yeah, I'm interested in if you have any other thoughts, Landon. I know you're working with some ball players, or I'm guessing you're working with some ball players as well. So, yeah, that's what I would say. Isometrics initially, alter the throwing sequence, and then also add in some... Guys, on YouTube, these questions, I don't know how to change it, but they go away so quickly. I saw something about exercise for biceps and triceps that I didn't see anymore. But eccentrics are good. I like to do eccentrics where they have to place their body in the position of the throw. I've found that to be very successful. So you guys that are just logging on, you're going to have to go back and we went around this whole facility here. It's phenomenal. It's beautiful. They're redoing everything up here. In terms of the weight room, some state-of-the-art stuff, bunch of new weight racks here on my right, and then nice little, I actually love the feel of the clinic in here because it's like a training room. I think it said Smurf. If your name's Smurf on YouTube, retype your thing and put it in there and I'll get to it. I'm going to be on here for about 5 more minutes, guys. So if you have any questions, put them in there now and I'll get to them if I can. I hope I've answered a lot of people's questions. I recently saw something on, yes, here we go. Do you have any exercise that can work the long head of the triceps? I feel pain above my elbow, right where my tricep meets, doing skull crushers. So if it's right above your elbow, I don't think we need to differentiate, which head of the triceps it is. They all converge into one distal insertion basically, and it kind of feathers out and surrounds both sides of the olecranon. So it goes here and then here. So long head, short, it's really medial, lateral, and long head. But really, we're not differentiating between the heads, I would say. You're doing skull crusher. It may not be which head of the triceps it is, but just in general in the skull crusher position, people are more likely to feel tension at the insertion. And that's partially due to the orientation of gravity and where the tricep or where the arm is getting pulled. And I'll get the same thing, so I think that's a common finding. And it's not necessarily the weakness of the long head of the tricep or any part, it's more so, I would say, just that the muscle's been shortened to, or lengthened to an insufficient position potentially. So what I would say is, if this is really bothering you up here, and you have some, triceps tendonitis type things, bring your elbow down and say, okay, do I feel it here, and is it a result of the position of my elbow? I would say, try to do some stuff where you're pulling from a cable column that's above you or a band that's hooked directly above you down, and then I'm gradually increasing the height of my elbow as I do it and decreasing the height of the attachment. So by the end, I'm pulling almost at the same angle that I would on a skull crusher. That's my advice. Try that out. I think some soft tissue mobilization, that sort of thing are good. It could also be due to, some torque being applied, external rotation torque, like a valgus torque at the elbow too, can kind of cause some of that stuff. So hard for me to say, but I would try a band attached above, low elbows. I do it there, then I work my elbows higher and higher while the attachment goes behind me lower and lower and lower. Let me know if that works. Comment. I've actually done some videos on triceps tendonitis and that sort of thing, triceps insertional tendonitis on YouTube. You can comment on there. I'll get back to you for sure. I respond to everybody on YouTube. Dealing with a little bit of pain when supination, get wrist, as well as turning doorknob to the right. Right hand, left hand. Wondering if you have any ideas what it might be. So I guess, you're having pain. I'm going to just guess you're right-handed for now. Turning the doorknob to the right, so you're supinating again. Extending the elbow. Right hand. Where are you getting pain, Matthew? Getting wrist pain or elbow pain? Daru, if that's your name. Sorry if I pronounced that wrong. How's it going, man? But if you're getting elbow pain with supination, it could be lengthening of something. You could have a little triceps tendonitis. If you're getting lateral elbow pain, a lot of times we're dealing with something with the actual radiocapitular joint up here. So think supination. The supinator actually attaches up here, tennis elbow, so you could be having some supinator tendonitis, tendinopathy. Outer side, out here I'm guessing. So the supinator attaches out there. Sometimes we see where there's a little bit of osteoarthritis. I don't know how old you are, Matthew. Osteoarthritis in the lateral elbow as well. So we'll talk about that. I didn't see that one. Something about falling down the stairs or falling on the floor with elbow pain. I don't know. Comment that again, and I'll get to it. Sorry, guys. So you're 20. You're a baseball player. I know that. You could have a little bit of something going on in the lateral elbow. I don't know if you've ever had an elbow injury of any sort in the past, but I do see sometimes issues in the lateral elbow, whether that's osteoarthritis, which you'd be young for that, but sometimes you see cartilage damage in the elbow at your age. I would guess more so than that, though. You're likely dealing with some tendonitis, tendinopathy there, probably of the supinator. That's pretty common. Sometimes I see that when guys have actually had a medial elbow injury first. So, what can we do about it? Well, one, soft tissue mobilization, functional massage. Flex the elbow, press into the tissue with a flat thumb. let it extend a little bit. Maybe you're gonna pronate. So now I'm gonna press into the tissue. Sorry, I'm getting too close. Press in and pronate, relax and supinate a bit. No pain, should elicit no pain. Find where it's tender, do that. I actually did a YouTube video of some different things you could do. I often will use a rolling pin and just roll, self-massage. That's effective a lot of times for tennis elbow type of symptomology. And then what else can you do? You know, I think in the end you're probably going to need to strengthen it. If you feel it as a result of throwing, you need to improve the sequence in your throw. You need to get more elbow flexion in your throw. And if you have an elbow injury on the inside of your elbow, that's something you got to address, because this could be a different thing going on, compression-related issue. So last chance, anybody wants a question answered? Matthew, let me know if that makes sense. Last chance. I'm going to log off here in like 3 minutes. But you guys stay tuned for some of the stuff we're going to be putting on YouTube here, because I got book reviews, I got 2 podcasts coming out. Another one's going to be filmed here briefly with somebody that's going to be really cool. I don't want to jinx it, so I'm not going to mention that one. And then also YouTube videos talking about throwing biomechanics. I've got some new stuff coming out on that, fixing stride direction, and in addition to that, we're going to talk about joint recovery supplements and stuff like that. All right, gentlemen and gentlewomen, thanks for joining. We'll see you guys in the next video. If you're on YouTube, you got to hit the thumbs up. You got to subscribe to us. You got to follow us if you're not following us, and like this live stream or whatever you can do on Instagram. I'm not too familiar. But make sure to subscribe. Get over on our other channels. We're always putting stuff on YouTube. I'm going to be putting and dedicating more posts here on Instagram. And maybe I'm going to figure out how to do live on LinkedIn, because we got a lot of people on our LinkedIn right now. So maybe that'll be our next one. And think of questions for the next time, because I definitely want to get to whatever you guys have. I'll see you guys.